Madhipura Christian Hospital, a unit of Emmanuel Hospital Association, is located in Madhipura, Bihar, serving the people of Madhipura and the neighboring districts of Araria, Saharsa, Supal and Purnia, which are among the worst 25 districts of India. It is a 100-bedded NABH accredited hospital, providing advanced medical and surgical care along with high-risk obstetrics and gynecology, radiology, dentistry, audiology, ophthalmology, ENT, psychiatry, physical medicine and rehabilitation, including occupational therapy and physiotherapy. The hospital has a 24-hour emergency service and serves as a referral center for many critically ill patients including trauma, poisoning, as well as symptomatic snake bites and many more. A well-equipped clinical laboratory with a wide range of testing, ICU and neonatal ICU with ventilators, as well as hemodialysis facility, helps provide specialized care to many sick adults and newborns of the region. We have a kind and compassionate nursing team who stand at the forefront of this mission. Their commitment and passion truly make a difference in the lives of those we serve.
Major surgeries and laparoscopic surgeries and various procedures like endoscopy, colonoscopy are done on daily basis.
Madhipura Christian Hospital aims at inspiring hope and transforming life by providing quality care with a compassionate approach. MCH is deeply committed to serving the poor and the marginalized, with a focus on the oppressed Mahadalit community known as Musahars.
MCH is a group of more than 200 staff, including medical, administrative, housekeeping, maintenance, mess, and networking department, covering more than half the states of India and even abroad. We all bring a piece of our culture into the life on campus, be it the food that we eat or the songs and dances that we enjoy from different cultures in our staff get-together. We love sports. We have cricket league matches at least twice a year. We have Tarang, which is a sports and cultural annual event where all the hospital staff come together to compete in teams of 4. For encouraging and building each other, we meet weekly for prayer and fellowship. For all of us so far away from home, MCH is a family.
The Madhipura Christian Hospital is committed to a group of Mahadalits called the Musahar people. Musa means rat and Ahar means eat. They are the poorest of the poor, bonded and landless agricultural laborers, denied health care and other benefits even by the government because they are considered outcasts and not just low caste.
The Madhipura missional movement began in the early 1900s when members of the World Mission Board of the Brethren in Christ Church, America, came over to Madhipura, a land with no running water, no electricity, no roads and no housing. Through difficult times, a hospital emerged in 1953 and now it is a 100-bedded NABH accredited hospital with many specialties and a number of committed staff serving the people of Madhipura.
Providing accessible and affordable healthcare was a major challenge. The community health team has done this through village health camps, follow-up home visits and telehealth.
The transportation is less available here, so they have to spend a lot of money for the transport in order to reach the hospital. They can have a consultation directly to the doctors through video consultation. People can access to it so easily and they don't have to wait for a long time.
Initially, the medical camps were designed to address the basic needs of the community. But slowly we scaled up and now we are providing comprehensive healthcare in these camps. We include eye services, we have started a mobile dental van, and we also have community-based rehabilitation during these camps. Hospital tends to meet the health needs of a patient. But in a community, we are able to relate to all their struggles. We see them as vulnerable as they are. We see their families. We experience their pain. The joy and satisfaction of going to the community each day far exceeds of what we can accomplish anywhere else.
In 2008, a dam near the Indo-Nepal border collapsed and mercilessly flooded 7 districts of Bihar. Among the worst affected areas was Madhipura. Precious lives were tragically lost, leaving families devastated and communities torn apart.
तो हम 6 महीना मध्यपुरा क्रिश्चियन हॉस्पिटल के द्वारा राहत का कार्य करने के बाद संस्था को ये एहसास हुआ कि ग्रामीण इलाका में बाढ़ से बचने के लिए, बाढ़ के साथ साथ विभिन्न आपदाओं के ऊपर कार्य करने के लिए एक आइडिया आया, जिसके कारण हम इस प्रोग्राम को शुरू किए, जिसको हम नाम दिए डिजास्टर रिस्क रिडक्शन प्रोग्राम.
The Community Development Program has community-based disaster management mechanisms to reduce the risk of loss of property, human lives, and livestock. Village disaster management committees and task forces in the target villages ensure disaster preparedness plans, early warning, rescue, and rehabilitation. Community participation for building embankments and creating awareness has helped reduce the vulnerability of these communities towards natural disasters. Through their interaction with the community during the relief, they identified disaster preparedness, food security, and combating human trafficking as areas that required attention. These were crucial for community development. The common vision was the upliftment of the marginalized communities by strengthening their livelihood, promoting disaster preparedness and safe migration along with anti-human trafficking initiatives. Hospital, through its Community Health and Development Program, implements a wide range of livelihood initiatives for the poor and low-income households. The program helps communities to have alternative livelihood sources.
यहाँ पे दूध तो बहुत है, लगभग हर घर में लोग दूध पालते हैं, लेकिन उसका इस्तेमाल नहीं हो पाता है सही ढंग से, और ना ही लोग चाहते हैं कि हम गाय को और संख्या को बढ़ाएं, क्योंकि उनके लिए जो दूध हो रहा है उसे बेचने की समस्या थी, तो आगे दूध हो जाएगा तो होगा क्या. अमूल का जो तरीका है उनके बारे में हमें कुछ पता था, और ये पता था कि इस एरिया में एक सुधा डेयरी भी है, तो हमने उनको गांव वाले को मीटिंग किया, और ये मीटिंग का एक दौर भी चला, और तब उनको ये समझाए कि अगर आप एक यूनिट में हो जाए, एक कर लें और एक ही जगह दूध डालें और आपको सही समय पर पैसा मिल जाए, तो ये कितना अच्छा रहेगा.
Milk cooperatives. Formation of cooperative for milk collection was an initiative that made cattle a blessing for the marginalized farmers. What began as a small cooperative with few farmers has now developed into 5 cooperatives with more than 800 farmers, adding milk as an additional source of income for their families.
इस डेयरी में लगभग 800 परिवार जुड़े हुए हैं. इस जुड़े हुए परिवार हैं जो कि अपना दिनचर्या का बच्चे को पढ़ाते हैं, और उनसे जो भी काम है या पशुपालन से संबंधित, जो पहले दूध मतलब कम दूध देते थे वो अभी ज़्यादा दूध दे रहे हैं, जिससे कि लाभान्वित हो करके.
System of rice intensification, which transformed an entire village from being under debt to a prosperous model village. There are more than 200 farmers at present practicing SRI technique for rice cultivation on over 750 acres of land, with significant increase in their yield as compared to the conventional technique of cultivation.
तो फिर मिशन ने हम लोगों को 10 में एक ट्रेनिंग दिलवाई केवीके के द्वारा एसआरआई का, जिसमें एसआरआई का कैसे बीज को उपचारित करना है, कितना बीज लगेगा, वो सारे नॉलेज हम लोगों को दिया गया. जो एसआरआई हमारे लिए ने पूरे गांव को परिवर्तन किया है, तो इसलिए उनको ताहे दिल से हम लोग धन्यवाद देना चाहेंगे. और इसके साथ साथ हम मिशन वाले को भी धन्यवाद देना चाहेंगे, क्योंकि मिशन ने ही हम लोगों को सिखाया था ये एसआरआई का.
Women-led agriculture with vegetable cultivation and the producers group have transformed the lives of landless farmers who were vulnerable and exploited.
ये वेजिटेबल प्रोड्यूसर ग्रुप जो है सर, ये जो मतलब खेती जो करते हैं, तो ये एक नकदी फसल इसको हम लोग कहते हैं. इसमें जो है इंतज़ार नहीं करना पड़ता है कि साल भर पूरा 6 महीना, ये सब कुछ नहीं. जैसे सब्जी लगाए, सब्जी उत्पादन हुआ, इसके बाद तुरंत ले जाके बेच करके तुरंत हम पैसा निकाल सकते हैं। तो ये एक नकदी फसल होता है।
More than 250 women are associated with these saving groups, practicing collective farming and also breaking the barrier of caste divide. Horticulture, goat rearing, fishery and small business ventures like petty shops have also been promoted to augment the household income of the marginalized farmers.
पूरा ये 1 एकड़ जमीन है, वो 1 एकड़ में नर्सरी लगाए हैं।
पहले की महिलाएं अपने आप रहती थी, अपने में रहती थी, अंदर रहती थी, किसी के पास बैठती नहीं थी। अभी कम से कम महिलाएं में कितना परिवर्तन हुआ है ना। खेत में जाकर के काम करती है, सब्जी होता है बेच लेती है, पैसा होता है गिन कर रख लेती है। तो परिवर्तन हुआ, ऐसे धीरे धीरे परिवर्तन हो जाएगा। मिशन का धन्यवाद हम क्या दें, हम तो मिशन का बड़ा आभारी हैं। हाँ, बहुत आभारी हैं। नहीं तो उस टाइम अगर हमारे साथ, अगर हम मिशन के साथ ना होते जाते तो आज इतना दूर पर हम कहाँ आते, हमारे पास घर कहाँ होती, हमारे बच्चे लोग कहाँ पढ़ लेते। अभी छोटे वाले बच्चे गए हुए कहाँ होता, ये संसार नहीं होती हमारी।
Poverty, lack of education and employment opportunities have cast the web of unsafe migration at Madhipura, leading to practices of human trafficking as well as child labor.
तो सबको की कहे छे से लोग आर जे छे से सब जमा रहे, अहिनी 10 साल के रहे, अइले बच्चा थे की कहे छे से सब कहू पहले दौड़ के गेलिए पकड़े ले, बाबू कते रही तू रे कना रही, तब सब कहानी या सब बतल के चना ना करके हम भाग के एलिए। हमरा डर भेले तो हम की कहे छे से एलिए वही करके।
कि कुछ जो बच्चे हैं जो 10 साल के 12 साल के बच्चे हैं जो बाहर काम करने के लिए ये लोग पंजाब, हरियाणा, दिल्ली है, बॉम्बे है, महाराष्ट्र है, अन्य जगह लेकर जाते हैं।
MCH Community Development Program have set up village child protection committees to facilitate safe migration in the villages, thereby preventing trafficking. Non-formal schools, adolescent groups receiving skill training and regular sensitization by the committees have led to a safer environment for women and children. Rupantaran is a community entrepreneurship initiative that provides economic stability to women and other vulnerable people from backgrounds like Dalits, tribal people, widows, people with disability, etc. This project helps women take control of their destinies by building their capacities and providing opportunities for personal and financial growth that helps them become confident and self-reliant agents of change. Koshi Kisan Umeed, KQ, is a farmers producer organization formed to bring hope for the marginalized farmers of the Koshi region. It has brought about 460 small and landless farmers of Madhipura under one umbrella promoting sustainable development for the communities. Shristi Community College, Home Health Aid course, training young women and men from the community and empowering them with skills so that they can go back to serve and uplift their communities. Non-formal schools were started with the purpose of engaging the innocent children who were otherwise vulnerable and prone to the risk of trafficking.
We have taken this initiative of non-formal school. It is run in 11 villages. In each village about 30 to 40 children come to school.
The challenge that we face in the village is that a lot of the parents don't recognize the value of education. So we have to actually convince parents, talk to them multiple times and convince them to send their children to school. And it's a real problem for them because they are so poor, they need these children to actually work, to bring back money to the household.
These schools provide the opportunity for the most deprived and discriminated children to learn and be a part of the community.
We believe that the community is not just for the hospital, but rather the hospital is for the community to bring about a change in their whole lifestyle.
It is a great blessing for us to be in Madhipura and see what God is doing. And we invite many people to come and see what is happening and join us in this endeavor.
On the sands of hesitation lie the bones of countless millions who, at the dawn of victory, sat down to wait. They waited and waited and waited and died. Friends, let us not wait. Let us not hesitate. Let us decide and take a step of faith. As the harvest is plenty, but the laborers are few, and the Lord of the harvest is waiting for you.